This is my client Jennifer, and she flew from Florida to get evaluation and treatment here at the Hesch Institute. I'm Dr. Jerry Hesch, a physical therapist at Hesch Institute in Aurora, Colorado. And I wanted to show you her pain drawings. She was injured, was it a year and a half ago?
Yep, 19 months.
And you were getting spinal and pelvic sacroiliac adjustments for the perspective of health. Your trainer had suggested you do that. So there was you were not symptomatic when you went and got that care.
Correct. Right.
And by description, it seems that it was very forceful.
Mm-hmm.
Is that correct?
Yes.
And as a result, you had severe pain ever since then. And this is a drawing of the back of the body, so you can see it's in the left thoracolumbar area surrounding the sacroiliac joint. And here's another pain drawing she did, and she colored it with yellow-green, the areas of pain, and has recently started to get a little bit of pain in the area of the right lower sacroiliac joint. So these pain drawings are very, very helpful in imaging what she feels. And the primary sensation is that of burning. How many physical therapy visits have you had since then?
20.
Okay, and how many different therapists have you seen?
About 4 or 5.
Yeah, 4 or 5 physical therapists.
Mm-hmm.
And most recently they've been treating you with muscle energy technique and myofascial work, is that correct?
Correct.
Okay. And it gives you about a day of benefit?
Right, a day or two of that, right, and then the pain sets in pretty quickly. Right.
Yeah. And right now you can't tolerate sitting. What's the longest you can sit?
Without pain?
Yeah.
1 minute.
Okay.
Maybe 30
Okay.
seconds.
Alrighty. Well, basically you quit your job, which involves sitting, because of your pain.
Correct.
Is that a correct?
Yes.
Okay. Standing is not tolerated well unless you're moving while you're standing.
Correct.
Okay. Well, I think I'll show a summary of the evaluation. We spent an hour taking your history and looking at you and testing you top to bottom, clearing your hip joints. And when we come to the pelvis, we find subtle asymmetry in the front. And asymmetry is just how it looks. It doesn't tell us about how it functions. I'm going to do a passive spring test on the right, and what we found was normal movement. So I could push on it to a natural stop point, and then I can add a spring, and it moves forward and it bounces back. When we do this on the left side, I can't really take up the slack. So if I can't take up the slack, I can't move it. It's stuck, so it's not moving. That's all I know. Let's have you lie on your stomach. Let me take this out of your way. Her left PSIS is lower, and it's also deeper. The top of the iliac shelf is lower on the left, and when I come underneath the sit bones, your left sit bone is lower. When I do a superior spring test, I see your head moves. Your head moves.
Pause and I gotta turn that off.
That's okay. Let me bring it to you.
Okay. Sorry. I thought it was on. Alright.
When I do the same test on the left, I can't take up the slack. This feels very, very heavy and immovable. Again, when I do it on the right side, I can move it to a point where the slack is taken up. It's a natural stop point. I can then add additional force, and that force is translated through the sacroiliac joint up through the rest of your body. And I see your head move. With this one, I can't even get to that point. When I do an inferior spring, we have movement on the left. And when I attempt it on the right, we have movement on the right. And when I attempt to do it on the left, there's no movement. So that left hemipelvis is very stuck. Now, someone has said you have a posterior ilium, and that's, I would say that that's a possibility, except for the fact that the left PSIS is actually deeper. With a posterior ilium, a posterior rotation, the PSIS becomes prominent. So that negates that. With a posterior ilium, you should have inferior mobility, but blocked superior mobility. You're blocked in both of those directions. So I don't think we're dealing with a posterior ilium. I think we're dealing with a downslip ilium. And the other thing that makes me believe that is when I come and find the sacrotuberous ligament, I can indent it a little bit. It's a strong structure, but it has a little bit of yield. On the left side, it feels like I'm on bone, but I'm on the ligament. It does not yield. It does not give. There's no bone in this area that I'm on. I'm on this location right here. So here's ligament, and you can see there's no bone in that area, and I'm trying to indent that, and it's very, very hard. The sacrum is uneven. The lower part of the sacrum, called the inferior lateral angle, is lower on the right. When I do a superior spring on the left, I get movement. I see your head bob. When I use the same amount of force, I get nothing. I cannot induce superior mobility through the right ILA of the sacrum. And when I palpate the sacrum, I find the PSISs, and I go medially, and then I go just above that, just slightly. So I'm at the upper sacrum. You look rather symmetrical. At the middle of the sacrum, at S2, between the PSISs, you look symmetrical. But as I come lower, you get prominent on this lower quadrant on the right. And when I do a spring test on the left lower quadrant, I can load the sacrum and I can spring it. I see both of your heels moving, so the force is going through the SI joint, down through the hip joint, down to the feet. When I do the same test on her right, I can't. I'm putting more than that amount of force used on the left, and there's no give, there's no yield. So she has a rotation called a torsion, and the formal terminology is a right sacral torsion on the right oblique axis. That's a mouthful, and it's a little hard to remember exactly what that means at times, but the terminology I use, and I wrote a book chapter on that, on sacral torsion, the terminology that I recommend is that you simply say that the right lower sacral quadrant is prominent and stuck. I think that language is a lot easier to understand. Now, when I walked along the PSIS and on the top portion of the iliac crest and iliac shelf, you felt like that was therapeutic. The pressure felt helpful?
Yes.
Okay. But we identified two locations where you're very tender, and that is on the transverse process of L3 and L4. So right here, if I dig in right next to that arrow, is this the area?
It's the whole, yeah.
Yep, I can get you to jump when I push that aggressively. And the other thing we found, when we have you in neutral position and when we adjusted the table and had you extended, is we found that pushing on the spinous process of L5, I was able to spring that joint. I was able to spring the facet joints. I'm able to do the same thing at L4. And when I do that at L3, it's easier to spring. And it seems to go a little bit further, so I would call that hypermobile. And then normal at L2. When I come over to the left side and I repeat that test, when we came to the spinous process of L3, there's no give. There's no give in that direction. So I can put my thumb there and try and push it. It doesn't move with a reasonable amount of force, but at that segment above it moves. Then we come down to this block segment, and then we come down to 4, and 4 moves, as does 5. So we have a rotation at L3 moving on L4, and it is rotated to the left. So the front of the vertebrae is rotated to the left, and that makes the back of it, the spinous process, go to the right. I have other YouTube videos. You can type in my last name and then whatever subject matter you want to look at. So you could type Hesch, H-E-S like Sam, C-H, and then sacral torsion, and you'll find lots of videos on that. You'll also find a lot of videos on downslip. And I'm suggesting that this left hemipelvis is stuck downward in relationship and with the sacrum, and the sacrum is side bent to the, is actually side bent the other way and rotated to the right. And that's a significant injury. If the sacrum went with the ilium into left side bending, that would be less of an injury. It's very unusual that those are not coupling together, but that those are effectively side bent in the opposite direction. Your pain rating on a pain scale of 0 to 10, what number do you rate it?
It's always about between a 6 to a 7, depending on what I'm doing. Sometimes 4 or 5.
Yeah.
If I'm not moving. And
Okay.
if I get it lower, if I take a bunch of pain pills and muscle relaxers.
Yeah. So most days it's 6 to 7.
Most days, right? It's enough to where I can't do anything.
Yeah. I mean, you had to quit your job. That's
Right. I walk around the house and like in a trance, trying to escape the pain.
okay. So this is the spring test evaluation that we use at the Hesch Institute. And I am going to treat her using very, very small forces over a long period of time to very, very gently counteract these restrictions. And we'll come back and we'll film our response to that. And the techniques have been shown elsewhere. I have, again, YouTube videos on sacral torsion, and I have YouTube videos on downslip, so I'm not going to show the technique here. You can look for that elsewhere if you like, but I'll stop filming right now.